At She Can, we tell women stories, how women get to where they are today, because it's so much easier to be what you can see. And I'm very excited to welcome Helen Grimshaw and Kerstin Recker Alexandra today, who are the co-founders of Peli Health, pelvic care for down there. So Helen and Kirsten, tell us a little bit more about this incredible venture that you've set up together as co-founders, and tell us about your journey, how you got to where you are today.
Absolutely. Well, I'll start. Thank you for having us, Stephanie. Really pleased to be here. And thank you for highlighting Peli Health to your audience as well. So I'm Helen. I'm one of the co-founders of Peli Health. And Peli Health is a medically reviewed women's digital health platform that focuses on women who are looking to either discover more about their pelvic health or women who are in distress over pelvic health dysfunction or disorders. And our mission is really to reach the everyday woman and to help her understand her symptoms, potentially her conditions, or either find help or educate herself about her health as she ages. Just a tiny bit about me. So I'm in the UK. I have 25 years experience working in media and tech and advertising. And I'm a mother of two, so I've also experienced the pelvic health challenges along the way. And I have worked with Kerstin for quite a considerable number of years. And I think this venture was definitely where I was supposed to land with all my experience in the past. I'll hand it over to my co-founder.
Hi, and thank you so much for having us here today. We're excited. I'm Kerstin Recker. I am the co-founder of Peli Health along with Helen. My career has been both at Fortune 500 companies as well as startups. I've worked across various industries from search and AI, media entertainment, ed tech, fintech, and now health tech. But while those might seem potentially all over the place, they've always been rooted in one thing, and that is really about driving solutions and partnerships for transformation. So health tech, especially women's health tech right now, is in a moment of transformation, one that is changing women's lives because we've had such a gender gap in healthcare for too long. And Peli is one of those companies that is working to close those gaps along with many other fabulous organizations. So couldn't be more excited about being part of that movement, both personally and as a founder of a company.
Kirsten and Helen, thank you so much for that. I know this is a severely underfunded and under-researched area, so every company that makes a difference here is really amazing. Tell us a little bit more what you do on a day-to-day basis for women and how it works.
Sure.
If you want to take it away, Kerstin?
Sure. Yeah. So what we have done and what we're doing. So I'll start with what we have done. And it really kind of speaks to the problem that Peli Health is answering. And I think you'll find common problems. You could look at menopause. You could look at postpartum care. You could look at cardiac care. But really what we're doing is there's a lot of information out there. And it can be overwhelming and or completely unrelatable. And I mean that from the consumer perspective, in the sense that there's medical journal research, not enough, I would argue. We're starting to see more as more women get into and become doctors, scientists, et cetera, or hold research positions that are starting to allocate funding, but still not enough. And I think those medical journals can often be cold and unrelatable or not even understandable, right? It's a different language. And so I think there's a challenge in terms of, okay, I'm overwhelmed with information. I'm not relating to information. And then access. And when we look at access, we think about it multidimensional. And what I mean by that is access to a pelvic PT and or a pelvic care physician. They tend to be aggregated around urban areas. Not everybody is in an urban area. You might be in a rural area. You can't drive 3 or 4 hours to get to that specialist. And so that's prohibitive. The other part of access is the cost. And I'm speaking now from the US standpoint here. It's out of pocket. Insurance usually doesn't cover it. It can be covered, but you're looking at $180 to $200 a session out of pocket. That's really expensive, especially in this current economic climate. So we look at accessibility, relatability, and then the last part is it convenient for me, right? And that's where we leaned into the digital health side, right? We need to be able, in today's modern world, for the modern woman, you're on the go, you are working, you might be juggling your family or your parents, or both, right? You just don't have a lot of time. And so having a platform that is quote unquote on demand, that you can do at your own pace, is really what we've delivered. So we've created over 400 and some articles that are evidence-based, medically reviewed, but written in a relatable way, and a platform that you can go at your own pace as you wish. And also you can enter based on your symptom condition, whether you want to be proactive or reactive. So that's kind of what we built, are building, and will continue to build.
Helen and Kerstin, and that sounds really exciting. So tell us what your main motivator is.
I think the main motivator is when we started this journey together, we've both experienced in different countries, but also at different times in our life, issues relating to pelvic health, and discovering that there was such a need and a lack of information, as Kerstin said, relatable information. And I think, speaking for myself, I've had a child born in the US and I had a child born in the UK, and both of my experiences were very different, but neither of those healthcare systems really told me about the importance of my pelvic health, especially postpartum, and how that would then change as I got older and went into menopause. I think you're given, some very brief description of doing a Kegel exercise, and good luck. that was kind of it. And depending on your delivery of childbirth, whether you feel you're more susceptible to pelvic health issues or not. You also don't have to be a woman who's gone through childbirth to have pelvic health issues. So as we go into menopause, for example, our estrogen depletes, and your pelvic floor is a muscle. And so as muscles and tissues will weaken, and that's when we start to see the emergence of things like incontinence, small leaks, for example. And that's just a very small area of pelvic health. But all these things are related. And I don't think there is enough knowledge for women out there to know this about their own pelvic health. I know among my friendship circle, when I've spoken about it, there's some pelvic, what is that anyway? So I think there's a huge gap. And I don't think this is geographic necessarily, US or UK. I think this is a worldwide issue. 1 in 3 women will experience a pelvic health disorder or dysfunction at some point in their lifetime. And that's a huge number of us. We're over 50% of the global population. We really need to understand this, because especially as an aging population, we're going to be required to be at work for a little bit longer, and sitting in meetings, for example, back to back, if you're someone who is an office worker, back to back without a break, needing to go to the toilet, it's bad for your pelvic health and your posture to be sat all day. So there's all these small things that are really contributing to your overall health. And for us, it's just one of the very few drivers of educating women to take control and self-management of your pelvic health, rather than waiting till you're that chronic crisis moment where you really do need support and health. And then we've gone to Kerstin's point earlier of access to a pelvic physiotherapist. How many of there are there to support that many women who've got issues? So where our real focus is about being proactive and educating, and hopefully getting ahead of those issues before they occur. And for those who are suffering, then the motivation is to get them the support and help that they need.
Which is so important, Helen and Kerstin. And I really think, if I just think about my own personal journey, I wish that one had that information much earlier, which we aren't given by the doctors. And that Kegel exercise that they ask us to do, I mean, I wonder how many people actually do it seriously. And I would have benefited hugely. Yes, I'm
you get given it on a printout, or here's a leaflet, take that. And you're like, what?
Yeah, absolutely. So
can I make one point about that, Stephanie? And I think, so you often hear about the Kegel exercises, or that is what is handed to you. And in actual fact, if you have specific conditions like a hypertonic pelvic floor, and I'm speaking as someone who experienced that, and what I mean by hypertonic, it's very tight, which causes severe pain. Kegels can actually do damage. And we don't talk about that nuance. And I think that's really important. I just wanted to add that in there, because understanding where your body is at is really important to know. What routine do I need to do to strengthen, to loosen, to relax, depending on your condition? I'll just add to that. So my journey into this was postpartum, C-section. I experienced excruciating pelvic pain. I was unable to have sex. It was exceptionally painful. It took me, despite going to 3 or 4 doctors, it took me 6 months before, through my own self-determination, found my way to a pelvic PT. And through that, I was learning, oh, stop doing the Kegels. Don't do that, because you're going to overwork your floor. First, we need to relax your muscles. And so it's just, it's a big thing of mine to be like, before you jump into Kegels, understand your body and know where you're at.
Yeah, I mean, I guess what we really all need to do, and this is something that you are there to help, is open the conversations, have the conversations with the doctors, get the doctors trained, or have services where women can benefit from that.
Yeah.
Just gives more information, because no one is like the other, right? Everyone is going to have, most women have issues along the way, whether that's during childbirth or not childbirth, or menopause, or whatever it is. But we simply don't have enough companies or enough trained doctors that have the conversations and say, you know, if this is the case, maybe it could be this, etc. pp.
Right.
So you need to build these communities where you can have those conversations. Yeah.
100%.
Yeah, so I'm so thankful for that, first of all. And second of all, how do you think, the two of you being a team, how do you distribute your qualities? What qualities do you have that make you good at what you do? And how does that work for you as a team?
Sure. Go ahead, Helen.
Boy, that's a big question. Well, Kerstin and I have been fortunate enough to have worked with each other in a prior job employment for quite a period of time. And so I think we already knew each other's qualities quite well and how we could complement one another. I don't think either of us would have walked into this, to co-found a company, one thing, both be on different sides of the Atlantic is another thing, and also in an area of women's health, which is extremely challenging to environment. So we've really gone for the peak of the hardest challenges. But I think from my perspective, as I've gone into this with the full confidence and knowledge of knowing what we both bring to the table. And Kerstin has a huge background in a lot of tech and digital, and she's very strategic thinking and also marketing and et cetera, et cetera. My flip side of the things, I've come from more of a biz dev side of the field of experience, again, still in the same areas that Kerstin has worked in. I think we bring different qualities to, one being operational, one being more strategic, etc. But then we're both capable of doing all of these different areas as well. So I think it's having that confidence of, we're almost operating like a 24-hour shift, and I'm asleep, she's awake, vice versa. So, but knowing that we both are capable of doing all of the tasks we need to do and combine. I think we're very good at resetting each other. When one of us is having a wobble, the other one will pull the other one up, and vice versa. And I think those qualities are about being empathetic, and I think those qualities are being focused, and knowing why you're doing what you're doing. Because I don't think anyone would take on the role of becoming a founder of a new company. You're definitely not going to be rich from day one, that's for sure. You're definitely not going to have any time to yourself. You're doing the role of, 50 people, and there's a handful of you. So you've got to really go into this, I think, with a passion and a belief as to A, who you're working with you trust, and B, you both are very much aligned on why you're doing this and what the mission is. I don't know that I've directly answered your question, but that's kind of where my take is.
I think that's great. Kerstin, would you like to add to that?
I would just add to that. I think, shared between us is courage, resilience, and determination. And I think those are really, and I would throw in curiosity, right? I think you got to have all those things if you're going to go after a business. And I think that is what unites us and really continues, right? Those early days of a company are really challenging. And so I think if you can find those core assets and lean into them when the days are maybe not as sunny as you want them to be, you will persevere, you will get through, and you know, will hopefully rise with resilience.
Yeah, thank you for that. So I'm wondering, tell us a little bit about the pitfalls. What are the pitfalls for you along the way? What are the challenges? How are you overcoming them or moving on? Where are you in your funding journey? All of that, I think, is really interesting information for other women who are starting the journey.
Sure. Yeah. Want me to take it?
Yeah, sure. Well, I'll start anyway.
Okay.
I think the pitfalls for us, as I alluded, is working in women's health. It's just eye-opening how lack of resource, lack of support, lack of funding there is. I think it's less than like 2 or 3%, depending on where your resources are from, of VC funding goes into women's health or Femtech startups. The amount is just unbelievable. And I think part of that is because the problem is not fully understood, or it's just a women's issue, but it's 50% of your population. And I think so there are some of the issues and pitfalls that we face is we don't want to make it a male or female issue. It's just health, but it's very, very unbalanced. And if we're to make up 50% of the workforce, 50% of taking care of your family and friends and elderly relatives, then we need to be supported in our health with equality the same way that men's health is addressed. But again, I'd like to stress it's really not a sort of a women's lib bang the bell sort of drama issue. It's just about getting the same level playing field. And that also falls into funding. Because if you can't get the funding, then I guess you have to be, as Kerstin said, have to have even more courage and resilience to get there. And they are the real major pitfalls that I see in what we're trying to do. I don't think it's unsurmountable. I do see there's a sea change. I think it's like turning a massive oil tanker. And when you start to equate this into value, economy, funding, little lights start going on, and eventually we'll get there. But it just might take us longer than maybe a counterpart would do in a different sector.
Yeah. Yeah, I'm very grateful that you said that, because this is not a min bashing platform where we are trying to, it's really about creating a balance, equal opportunities, and address the areas where we fall short, as in, as 50% of the world population. And we are severely underfunded and severely underrepresented in the health area. And as you said, if we want to be 50% of the workforce, we need more support. And so thank you. Kerstin, would you like to add?
Sure, and I'll be more I'll be a little bit more micro specific to some of the challenges with Peli, because I think Helen's done a wonderful job of kind of highlighting the macro. So in terms of Peli Health, just our own journey in terms of pivoting, as you mentioned, early on when we came together, we had this idea of mashing people to pelvic PTs because there wasn't a quote unquote directory. And that seemed like a good solution based on where we stood in the market and our own personal experiences. Obviously, we've pivoted since then, but I think the nuance is how we got there. So we worked together. We built a very lo-fi prototype concept. And then we surveyed 350 women. We also ran focus groups. And through those conversations and through that survey feedback, we were able to get a lot of information, not just on what they thought about the solution and our ideas we had, which is really important. But I and I think no matter, again, what type of business you're entering into, understand your customer journey. And I'm not talking about click, click, click on the web. I'm talking about where is their mindset, right? Whether it was someone who was wanting to be proactive about their pelvic health, what's that journey? What are they looking for? Where are they looking? Why are they looking? How are they feeling along that journey? Same thing, someone who's currently what we call quote unquote in crisis. And what I mean by that, someone who's actively experiencing symptoms, be it leakage, painful sex, spasms, whatever it is. understand where a patient like that is in their journey. Are they in distress? Are they depressed? Which, by the way, mental health is company's pelvic health. You see a lot of connected depression, as you can imagine. It's your core, it's your center, it's your sexuality. So you see that. So understand that, understand what language they're using to search. And tip, get on and look at search trends in your industry. That can give you a lot of insight. So through all of that, equipped with that data, we were able to take it back, look at what feedback we got and say, you know what? Maybe we need to pivot direction. And we also learned something very important, which was, where do we start with the conversation of pelvic health? Because we were maybe a little bit further down, and we were a little bit further down because the assumption was that, oh, now you know you need it. No, a lot of people started with, what is my pelvic health? What does that even mean? So really getting to the basics was a good insight for where we needed to start with the product. And now we're really education driven. So I share that because pivots are part of the startup journey. They're a critical start. And it's not just the startup journey. As you move from starting to traction to scaling, you will pivot a number of times. But don't look at them as a fail. Look at them as a lesson learned, and be really fast to react with that. So that's all I would add to your question.
Yeah, and I'm so grateful that you said those points because they're so important. Kerstin and Helen, so what top tips would you give to a woman who either wants to be proactive or is actually in crisis mode? What are the top tips around women's pelvic health?
Yeah, well, look, I think the first one we've kind of covered is you unfortunately going to have to go and self-educate a little bit, but go and find that support, and don't sit in silence and embarrassment, because that problem is not going to go away on its own. The good news is that you can probably, depending on what stage you're at and whatever it is, do something about it. And it's probably not that unsurmountable, but it's about catching things early or being proactive in the first place. That doesn't apply, I should add, to all pelvic health issues. That's sort of a sweeping statement, but there are those that require obviously a lot more medical intervention. But do speak. There are people out there, wherever you are in the UK or US, there are people out there who are medically trained who can support you. If you feel that you're not listened to, or it's being dismissed, which we know medical gaslighting is a big issue in women's health, then you must persist and potentially track your symptoms. What are your symptoms? What is it you're experiencing? So when you do go to see somebody, if you're in crisis, then you have historical data that you can show. Take someone with you if you feel you're going to be dismissed, because we do know that a lot of women can take between 7 to 10 years to be diagnosed correctly with a pelvic health issue. And that's just that constant either dismissal, or that the symptoms aren't always showing up, or potentially that you've sort of sat on the issue and you're embarrassed, or you've got that stigma or shame about it. So I think my biggest tip would be, first of all, go and get some help. If you're being proactive, read, learn, come to Peli Health, learn about your pelvic health, because it is really important, and it's even more so important as we age, because your health will change. Kerstin, do you have anything to add?
Yeah, I would add to, so I smiled when you said medical gaslighting. Along my journey, right, I had mentioned that I had seen I think it was 3 or 4 doctors. Well, and I was told by one of them, just relax, take a deep breath before you have sex and it'll be better. So my point is, that's not the answer, right? That is someone that doctor is not meant for you. There's somebody else that's meant for you. So I just want to add that, because I was like, oh, it happens so often and I've experienced it, and it's infuriating, right? Because it diminishes how you feel. But I digress. Back to your question. I think Helen has laid out a phenomenal tip in terms of educating yourself. I was going to say, sign up for the wait list for Peli Health. We would love for you to be there. It's a great place to get educated. But really, we've also partnered with clinicians and practitioners. And so we have a clinical review board. We also work with pelvic PTs and or trainers that are certified specifically in pelvic health. So you will find more than just text there. There are programs, etc., available to you. And I'll share some stuff. I am not coming at this from a medical point of view. So I would always say, do speak with your healthcare provider, but we will share some stuff. I will share some stuff that we've learned. One of my favorite ones is one of our partners, 2 of our partners really talk about breathing. really deep, mindful, diaphragmatic breathing. And that is taking in a big, big breath, expanding your belly, feeling it go all the way down to your pelvic floor, and then releasing from the pelvic floor, the stomach, and then out through the mouth. And it's interesting when you really close your eyes and tune into that, you'll start to feel that release in your pelvic floor, but also in the tension in your body. So honestly, start there. And the reason why you begin to relax the floor, you start to become very mindful of your muscles. The second thing, and these sound so basic, but we don't do them often, put a mirror down there, look at your pelvic floor, get to know it. So do those deep belly breaths, lay down on the floor, put a mirror down there, squeeze like you're lifting a blueberry, not like you're kind of like, stressing. See what that movement is, because you want to strengthen that mind-body connection with that part of yourself. Really get into it, because the more mindful you can be about how you breathe and you can visualize how your pelvic floor is moving, the more conscious you will be as you do things throughout the day, like picking up your laundry. If you have a child, picking up your child. If you need to help a parent get out of bed. And I say that because all of those things put stress on your pelvic floor. Honestly, starting there. Now, depending on what conditions you have, you might need to do Kegels, or you might need to use a dilator. But that's why I think at that point, you need to start getting in to speak with someone who's a specialist. But truly and honestly, breathing and get to know your body. Really look at it.
Yeah, I love that. Thank you so much. And I think it's still a taboo topic, isn't it? We still
It is.
talk about it. The gaslighting is real. And so, yeah, excellent tips. Thank you so much. So, what would you say are you both most proud of to date on that journey together?
Yeah. I would say, I'll jump in. I'll say,
Yeah.
having the courage to take the leap, right? It is a big jump to go from a corporate job to starting a company. And I'm not going to lie to you, it's terrifying, right? You're like, oh my gosh, I'm jumping, I'm doing it. But boy, does it feel good. And boy, is it empowering. And man, does it feel like waking up motivated every day. Doesn't mean it's not without it challenging. But when you bet on yourself, something magical happens, I think, mentally.
Yeah, I'd say a similar line to Kerstin. We've both come from corporate jobs, and we've both, traveled a lot in our lifetime with work and other things. And I think you do feel extremely proud, especially it's the small things, especially at the early start of your journey as a founder. Your website goes live, or someone mentions you in the media, or you get someone come to you and say, I think for me anyway, I've had people come say, oh, I read that thing that you posted. It was really good. I didn't know that. And they're like, oh my gosh, it's actually resonating. It's working. If we can educate 2, 5, 10 people, yeah. I'd be so happy. I mean, obviously, I'd like to multiply that by millions, but ultimately, just getting to educate a few women or opening a conversation, which I've had plenty of since I've started this within my own French circle, and I know that Kerstin has too. I think those moments are just so make you very proud. At least you're contributing towards something that hopefully will have a lasting change. And as you just said, Stephanie, isn't it amazing we're talking about these things now, because it was very uncomfortable to talk about, but more and more we're seeing it in mainstream media, which is great.
Yeah. So what are your plans, your dreams, your goals? How are the next years planned out for?
Well, we need to get Peli Health in everybody's front of mind when they think of their pelvic health. And that's a huge mission for us. And I think our goal really is to have the platform established and to see the results of the women who are partaking in the platform, to get them that help and support. So for us, our mission critical is to get that traction on the platform. And also then as we start to expand into other areas, I think it's also important to know, I should just add, I'm not sure about the future focus, but that men also have pelvic floors. And one of the things that Kerstin and I started with is to have this conversation around with women, because we are women and we're experiencing them. But if you can't get women to talk about it, you've got no chance of getting men to talk about it. So I think that's part of the future vision, that we all should all, as I said earlier, it should be health tech as opposed to female or male. And I think that's part of the vision.
Yeah, yeah. Kerstin, what would you like to add to that?
I think Helen did an excellent job of answering that question. I would just say we want to be the go-to solution for pelvic health and wellness. And by that, I mean, you can go as a consumer, your physician or pharmacy may be recommending that platform to you, but really it's about a massive awareness, education, and activation campaign to improve overall pelvic health and wellness.
Yeah, amazing. So do you have role models, either one of you or both of you, and who are they that motivate you and inspire you to reach for that big vision and make it a reality?
I thought about this in the past when I've been asked, and there are different women that pop up into my mind from a business perspective, from an advocacy perspective, or even just my own mother. So I think there are a whole different role models that come into your life at different stages. For me currently, I think our England's women's health ambassador, who's just been nominated for the second year. We only got them for the first time last year, and she's now in for a second year. So Dame Leslie Regan, or Professor Dame Leslie Regan, has worked for over 40 odd years in women's health, and she is pushing the women's health strategy in England and for the NHS in England. And I hope that she is hugely successful in getting that strategy rolled out, and also across other areas of the UK. So for me, she's currently, and well, I say currently, she'll be one of my many role models that I'd like to follow.
Yeah, it's great that you mentioned her. And Kerstin?
Yeah, so I think mine is twofold. As Helen said, I think I have been fortunate enough to have some really great men and women mentors, to your point, Stephanie, right? This is not about male bashing. It's where are your allies, right? Who's on your team? And some of them have been my bosses. Some of them have been my clients. Some of them have been my coworkers. But I am always amazed at the lessons I learned from them and with them. And I think that has always motivated me. But I also speak to a woman who I think Helen and I both very much look up to, is Ida Tin, the woman who coined the term Femtech, right? There was a true innovator, and she still is, right? An innovator, cracked a category, really put Femtech on the map, right? And I think there's a lot to be learned from her today, and from the lessons and her experience throughout her tenure.
Yeah. Helen and Kerstin, thank you so much for showing up so authentically, really speaking truth, for such a great vision, for introducing Peli Health to the She Can audience, and for telling your story, which is really hugely inspiring.
Thank you so much, Stephanie, for having us. I'm really pleased that we got to talk to you today.
Yes, thank you. And thank you for creating such a fabulous platform that you've put together. You are inspiring to us.